I'm really happy that the candidates who were practicing mocks and everything with me before this, they have all cleared their exams, even though a few of them, were the first ones to receive news stations in their exam, and they have even passed those. I'm really happy because of those things. So I had a lot of small celebrations to celebrate, which I'm really glad about. So today's session is about anuresis and approach to these scenarios, examination and management. Now, how do you verbalize examination on a telephone conversation? And how do you know examination is relevant in which scenario? So I'll just briefly talk about that, and then we will move on to management. We are not going to discuss all of the details which are already there, because I know that by now all of you are experts in these two topics. I will just go through the changes or the different ways you can incorporate different things in your scenario and stand out as a candidate. This is what we are going to look at today. Okay, moving on. So approach, what approach is, what I recommend is this. So this is very simple. You go in, you introduce yourself, you confirm the patient's identity, or the person on the telephone, their identity, confirm the relationship, the location, safety. Is it a good time to talk? Where are you? Can you spare some 5 minutes so that we can have a chat on the phone? All those things, all those formalities. Later comes presenting complaint. So apart from this complaint, is there anything else? So allow this person to speak. They should say all of their complaints on their own without you giving them hints. Okay, now what happens is, when you go in and you say, okay, so you told me that your child is wetting the bed at night. Is there anything else apart from this? So the mother says, like what, doctor? And then you start your history taking, that is, you start elaborating, and you say, oh, like, I mean, what about the daytime? How are the daytime symptoms? Okay, what do you think has triggered this? And then you go on to finding out whether it's a primary type of enuresis or a secondary type of enuresis. You find out the trigger, so you move on that way. But instead of that, what I recommend you do is, when you have asked the mother, okay, what have you come here for, or how can I help you? So she says, yeah, my child is wetting the bed at night and I'm quite concerned about this. And then when you ask her anything else apart from that, she says, like what? So what you can tell her over here is, so you just told me that you are quite concerned that your son, whatever his name is, Harry, let's say, Harry is quite concerned, Harry is wetting the bed at night, and you're quite concerned about this. Is there anything else that bothers you? So then she will say, no, no, doctor, nothing else. Okay, then safely you can move on. Okay, so could you just tell me a few details about this? Let her speak. Always let her speak. She will speak, but it depends on how you negotiate. Okay? Allow her to speak. Allow her to use her own words, how she started, what she started. So basically, when you allow this person to talk, they tell you everything you need to know in 2 to 3 minutes. That is the entire history that is relevant, why this has started, and how has it progressed, how it used to be before, how it is now, are there any associated symptoms, what about the daytime symptoms? Everything she will tell you. Believe me, they do this. Okay, just encourage them to talk and learn the art of negotiation. So two people who are study partners, you can practice one time by being a simulator, who is someone who encourages the doctor to ask all the questions, and the other time when you practice with each other, be the simulator who says all the information that is required in one go. So when you practice this way, you will have practiced both the approaches and you will feel much more confident in the exam. So that's why I recommend this when you are practicing among yourself. We do have practice in our situations and scenarios in our group as well. I have just been putting off organizing them because, of course, like of the issues I mentioned earlier. But anyway, we should hold them more often. So let me see what I can do about that. But this is generally how things go. Like I said, please encourage the person on the phone or the person in front of you to talk instead of giving them words. Okay. Now, moving on, what do you do after the chief complaint? After you've elaborated the chief complaint, you ask about red flags. What are red flags in enuresis? Can anybody tell me? Red flags in the enuresis scenario? Yes, very good. UTI symptoms. Daytime symptoms are, they're not red flags, but they are amber flags. Okay, they are not red flags, but amber flags. But red flag is definitely UTI. Okay. Now, moving on, constitutional symptoms. So basically, constitutional symptoms, I'm going to talk about them in a little bit of more detail, and I will tell you, instead of the meningitis questions, you can ask these questions. It will look much better on you. Now, moving on, after this comes past medical history, lifestyle, and family. So I'm going to elaborate constitutional symptoms, past medical history, lifestyle, and family today. Okay. So let's come to constitutional symptoms. So what are the constitutional symptoms? Basically, I'm asking head to toe symptoms. Have you noticed any fever, any cough, or any runny nose, any breathing difficulty, any unusual or concerning behavior of the child, any pain? Have you noticed them to have any pain? Moving on, wee and poo habits, weight loss and weight gain. How is the child? Is he alert, active, and playful? And how would you describe the child's sleep is? So this sleep question comes in history of presenting illness, especially in the aneurysm scenario, but it is a part of the constitutional symptoms. Please remember, instead of asking those same things again and again, does your child have any fever? Have you noticed any neck stiffness? Have you noticed this? Have you noticed that? Every single person on the day of your exam is going to ask those same things. Please, my request is, there is something known as constitutional symptoms. It is different in adults, it is different in pediatrics. Basically, it consists of asking 1 to 2 questions related to each and every system in the body. For example, CVS, CNS, RS, per abdomen, yes, GIT, GUT. So each and every system of the body, 1 to 2 symptoms, asking questions about 1 to 2 questions about each and every system in the body is what constitutes constitutional symptoms. Instead of going in and saying the stuff about meningitis, please do this. This will look much better. Okay, now moving on. Past history. Now, the other most important thing I want to discuss in past history is, if the child's age is less than 5 years, then please do make sure that you ask an antenatal and a postnatal history. That is, it includes everything. So, when you were pregnant with this child, did you have any infections? Were you diagnosed with any medical conditions? How was the birth of this child? After birth, was everything okay? Was the child hospitalized? Any conditions that the child suffered from, like fits or jaundice or any fevers with neck stiffness? Okay, so all of this comes under antenatal and postnatal history. I have summarized these for you, but I think everybody already knows what are these questions. I expect that you are all experts in all of this. If you are not, then what you can do is just uh, make a list among yourselves. Who are those people who are new to this and who want to know more information about this? So I will hold a session. Okay, anybody can join, but then those people who would like to know more details of these history taking what do you say, pearls, then you can just let me know, so even I know that um, that okay, this is the new batch which has come and I need to focus more. Otherwise, what I assume is that everybody is an expert and I just need to summarize. Okay, so please do let me know whatever your needs are. Please let me know. I will try and arrange what I can. I know that there are delays, but it will definitely be done. Please trust me for that. Okay, now moving on. Immunization. What I've noticed is some people are directly saying, so what about your child's immunization? Is your child immunized? And then the parent says, what do you mean by immunization, doctor? So you're wasting 1 minute over here. Okay, so please don't do that. Instead, ask, when was the last time you gave your child vaccinations? Or is your child up to date with all the jabs or vaccine? Instead of immunization, please try to use vaccine or jabs. Okay, please do not use the word immunization. It will waste your time. Moving on. Do you have any concerns regarding your child's development? No, doctor. Instead of the red book, you can say, what about the health visitor? Do they have any concerns about this child? Now, let me tell you, there are 2 types of representatives. One is the social service worker and social services worker, and the other one is a health visitor. Social service worker is the one who is basically rumored to be the one who separates the kids and the parents. Okay, this is what the parents say every time you say, is there any social worker involved in the care of your child? And then this mother or this father says, what are you trying to say, doctor? They'll waste your time once again. What are you trying to say, doctor? Are you trying to say I'm a bad parent? Are you trying to say that I do not take care of my child? Is that why you're asking for the social worker? So please do not ask that. Just ask, what about the health visitor? Do they have any concerns? So health visitor is basically the friendly one. Okay, they are people who visit the home of the children, or the families, and they try to find out if developmentally everything is okay or not. So these are the health visitors. Health visitor, using the term health visitor or talking about the health visitor, is a more friendly approach than social care worker. Now please do not confuse yourself with non-accidental injury stations. We are not talking about those. When I talk about non-accidental injury, I will tell you the role of social worker and how to talk to the mother. Here we are not talking about them. Okay, so like I said, please remember there are two, like the angels of the right and the left, there are two people over here. One is the social care worker and the other one is the health visitor. The moment you mention social care services, please be aware that any scenario it may be, it will cause alarm reactions from the parents. So when you deal with NAI, you can take their name and explain about them, no problem. But for the other scenarios, you can use health visitor. It's a much friendly term and a friendly approach to talk to these parents. Okay, moving on. Let's talk about enuresis. Okay, the rest of I hope that everyone is okay with the history taking that I have explained. One thing that I missed out, yes, lifestyle. When I say lifestyle, what I mean is diet of the child. So are they bottle fed, are they breastfed, are they eating any finger foods? What about the water intake? What about dietary fibers? So these are the questions to ask for the diet. Okay, family. Now I have included family as a completely different entity on its own in history taking, because in family there are quite some things you should ask. Okay, those are: number one, who are the care, so you and your son, okay, or your daughter, is there anyone else who is in the family? So basically you're asking for the father. So she will tell you, or he will tell you, information regarding that, about the other parent, any other carers. Okay, so that's what I mean when I say that. So that's the first thing. Second thing, is there anyone in the family, or you or the partner, have any of you had similar complaints as children? Okay, so you want to ask if there is a history of constipation or of enuresis in the family. Okay, this is the other thing. Now about the family, so are you working, is your partner working? You also want to know those details, if they are working or not. The other thing is, what you want to ask is, yes, about anyone who is smoking in the family. Okay, so this question is very very important, especially in scenarios like this, like enuresis, constipation, any behavioral issue scenario. Please do ask about history of smoking in the family. Why? Because it has been shown that when any of the parents smokes in the family, it causes the children extreme distress. So if there's anybody who's smoking, please know that your child must be really distressed. Please do not smoke. And to those who are going for the exam, please do remember, this is a emotional trigger in itself to cause some type of conditions like this in the family. Okay, so this is a very important question to ask. And this is about the history taking of pediatrics. I hope that you have followed what I have said, and I have made sense in what I have said. If you want me to repeat anything, please let me know. I will repeat now because I'm going to move on to the management right now.